So let's talk about the ethical decision for today. If a child with ADHD is medicated to improve focus, academic performance, and emotional regulation, then this may raise ethical concerns about overmedication, potential side effects, long term brain development, and the child's capacity to consent, potentially compromising values like body autonomy and natural development. But if the child is not medicated, then they may face academic failure, behavioral problems, social issues, and emotional difficulties, and potentially neglect their right to effective treatment. Today, to further elaborate on this ethical dilemma, I will be interviewing several of my family members, all of which have ADHD. But what is ADHD? So, ADHD, aka Attention Deficit Hyperactive Disorder, is a developmental disorder marked by persistent symptoms of inattention, hyperactivity, and impulsivity. Symptoms typically begin in childhood and can significantly impact daily life, including social relationships, as well as academic or professional performance. Some studies found longitudinal research that links a negative school performance and ADHD symptoms. A that means that kids do worse without appropriate treatment in school settings. Similar results were found in a qualitative review by Chang. So, when we think about our ethical decision, do I treat or not treat my children who have ADHD with medication? So, before we talk about that, how is ADHD commonly treated? So, medications such as stimulants or antidepressants and therapies such as cognitive behavioral therapy or even family psychoeducation are the common ways people are treated for ADHD. Stimulants are the most common type of medication used to treat ADHD, and research shows them to be highly effective. They work by increasing levels of brain chemicals involved in thinking and attention. Not treating ADHD has been found to decrease quality of life and stigma both in the child and in the family. So, am I in this ethical decision? As a mother, I'm the leader of my household. I work in a school environment and I'm also a therapist. Additionally, as previously stated, I have two children with ADHD, and I'm married to a husband with ADHD, and I have ADHD myself. Sammy, one of my daughters, has been on medication since she was 6 and is almost 11 now. Abby just started medication a few months ago at age 13 when she was diagnosed with autism and ADHD. As an ethical decision maker, I must navigate competing values: the desire to support my family's well being and functioning, the potential risks of medical intervention, and the importance of honoring their developmental voices in healthcare decisions. I must determine how to proceed while minimizing harm and preserving my child's rights and best interest. This dilemma is not only personal, it echoes broader societal debates involving families, educators, medical providers, and policymakers. So, what are the solutions to the problem? I could medicate my children in helping them improve their school and social performance. I could not medicate them, but also provide them cognitive behavioral therapy treatment. But there's an ethical downside to either choice. So, to talk about the possible solutions to this ethical issue, while still reviewing all the facts as a pragmatic leader would do, I will be interviewing Abby, Sammy, and Ryan. Hi, Abby. Can you tell me what ADHD feels like for you?
It feels like my brain is doing 1,000 things at once, and it's a bunch of tabs, and then there's music playing on one, but I don't know how to turn that off, and a bunch of pop ups.
Okay. And I know you recently started medication, right? What was school and home life like before you started the medicine?
Um, I couldn't do the same thing for a while, or I'd just forget about it completely.
Okay. And now after the medication?
I can finally close the 1,000 tabs and do one tab at a time.
Okay. What do you think are the good things about ADHD medication?
You're able to focus on one thing at once, and your brain is following one path instead of digging a bunch.
Okay. And is there anything that you've worried about with taking medication?
Not really.
Okay. If you didn't use medicine, what do you think would have happened?
I probably wouldn't have to deal with the 1,000 tabs, and I don't like dealing with them. They're very loud and annoying.
Is there anything else that's helped you besides medicine for ADHD?
Off the top of my head, I can't think of anything.
Okay. Do your friends and teachers know you're on medicine?
Yeah, I talk about it all the time.
Okay. And has medicine helped you with school or friendships?
Yes, because I can better socialize and stay on topics with other people that I'm talking to and just stay on path.
And do you think we made the right choice by starting medication?
Yes.
Would you make the decision differently if we were to go back in time?
No, probably not.
What do you think you learned about starting medication? That you can focus better, maybe?
Maybe.
Okay. Anything else you want to say about medicine? I mean, maybe about your appetite? That might be the one downside, right?
Yeah, appetite, the lack of it sucks. Probably not healthy to not want to eat.
Yeah. Hi, Sammy. Can you tell me what ADHD feels like for you?
It feels like I don't really know. I don't know how to explain it. When I don't take my meds, I feel more like I can't focus and stuff. It's like I have to wiggle around a lot.
So
ADHD feels like I always need to be moving.
Okay. And do you remember what it was like before you started medicine, since you started it so young?
Yeah. No.
How about on days you don't take your medicine?
On days I don't take my medicine, it doesn't feel as good as when I do take my medicine because I obviously can't focus and I don't know how to explain it without saying things over and over.
That's okay.
I don't know how to explain it really.
So recently we upped your medicine, right?
Mm-hmm.
And we talked to you a little bit about it before we made that decision. How did that feel? Do you feel like you had a choice?
Yeah.
And do you think there is good things about ADHD meds?
Yeah.
And what about not good things? Can you think of any not good things about it?
It makes me not very hungry. All the time. It makes me feel like I'm not hungry sometimes. But when I don't take it, it makes my body feel really hungry.
Mm-hmm. If we didn't use medicine, what do you think might have happened?
I don't know.
And is there anything that has helped you with your ADHD besides medicine?
Fidgets, getting to be able to get up and actually move a little and then come back and be able to sit down.
So like taking breaks and stuff? Yeah. Or wiggling at the back of the classroom or...
Mm-hmm.
Okay. Do you think kids should have a say in decisions like that? About medicine?
Yeah. I don't know.
Well, my theory is, right, it's your body, but some families choose to make that choice for their kids rather than talking to them about it first. What do you think?
I think they should talk to their kid about it first, so the kid doesn't feel like they're being forced to do it.
Yeah, good. Do you think we made the right choice?
Yeah.
And do your friends and teachers know you take medicine?
Yeah.
Are you okay with them knowing?
Yeah.
Okay. And do you think it's helped you build better friendships or helped you in school?
Yes.
Yes to both? Okay. And if you could go back and make the decision again, would you do anything differently?
What decision?
To take medicine?
Mm-mm.
And what advice would you give another family who's facing that choice?
Try it out first, see what works right.
Yeah. Don't give up, sounds like. Yeah. Good. Hi, Ryan. Can you tell me what ADHD feels like for you?
Well, I would say it kind of feels like my blood is boiling and nothing is moving quick enough.
And when we talked about medicating our kids for ADHD, what were your first thoughts about it?
Hoping that they didn't have symptoms that I had, not symptoms, but side effects from the medications.
And do you think your own ADHD medication experience shaped how you saw that decision?
Yes, definitely.
And what do you think are the good things about ADHD medication?
Helps you focus and get your work done and be productive in general.
What are the downsides?
Keeps you from eating, keeps you from sleeping, and makes you irritable.
And you mentioned side effects that you hoped the kids wouldn't experience. Can you talk about those?
Basically the same. Irritability, not sleeping, not eating.
And if we didn't use medication, what do you think might have happened?
I think it would affect them in school and with friends. Makes it more difficult to make lasting relationships with other people. Sometimes when the ADHD takes control, nobody else is moving at the pace that you are necessarily. Impulsivity.
Mm-hmm. Do you think there are things that have helped you besides medication?
Breathing, long, deep breaths, and recognizing when it's more active than not.
And I know you used to be on medicine, but you're not anymore. Can you tell me about that choice for you?
All of the medications seem to have side effects, whether it's feeling queasy to not eating and not sleeping to irritability. So I haven't really found one that doesn't have a side effect for me that outweighs the pros.
And how do you balance allowing the kids autonomy, so letting them speak for themselves, and making a decision like this?
They don't really, at this point, have a choice. I think later that they will be happier about it just because it's much better for their school life and their friendship building, but they don't always agree with taking it. I think there's some of the almost depression that comes with it that at least one of the kids shows when she's on it, but we have to just balance it out. Try not to give too high a dose and watch her.
Do you worry about how medication will impact them later?
No.
Do you think we made the right choice?
Yes.
And would you do anything differently if we were to go back in time?
No.
What do you think we learned as a family in this process?
I don't know. I think that there's plenty of ADHD running in our family, and we just have to accept it and do the best we can. Medication seems to work for now. Maybe it won't always, and maybe it won't be needed when they get older. But I think it helps us as a family.
What advice would you give to another family facing the same decision?
Just to keep a close eye on them when they're medicated and when they're not medicated, and look for the differences. Decide if the pros of the medication outweigh the cons of taking it, if there are any. Go with as low a dose as possible.
Any other comments you have?
No.
So we've interviewed Abby, Sammy, and Ryan about what ADHD feels like for them and the pros and cons of taking ADHD medication. We'll talk a little bit now about what ADHD feels like for me and what choices I made, as well as summarize what we talked about throughout the interview. So ADHD to me feels like a buzzing, and it's constant, and I feel like I have to move and wiggle and have all these open tabs open. I don't take a stimulant for ADHD at this time because my doctor had indicated that my age is a factor that could contribute to bad blood pressure as a result of taking stimulants in at my age. We are still exploring medications and what may or may not work for me. I'm also a therapist, so I see this from a dual lens, right? I, as my job, do behavioral interventions and talk about cognitive behavior therapy and elicit those same solutions at home. And then the medication was on top of it to help. I think for me, it's important to allow my children to be a part of the decision making process because it's their bodies at the end of the day. As they age and grow, we can revisit the decision to take medication. And as we learn throughout this process, they both girls feel that taking the medication was the right choice, and so did my husband as well. Ryan indicated in his interview that children should not get a say in whether they take it or not at this age. However, in the process, we did talk about the medication. Yes, at the end of the day, we would have made the decision that worked best in our opinions since we are allegedly older and wiser. I do worry about negative side effects of medication, especially because it's stimulants and we have addiction in our family. And that's something that I think I'll always worry about because it is a stimulant, right? And otherwise, I worry about them being able to make friends and fit in and do their schoolwork without the medication. And I think there are pros and cons to any decision making, right? And I recognize that there is potential ethical blind spots, right? So in our school texts, we talk about the ethical blind spots being overestimating our ethicality, forgiving our unethical behavior, in-group favoritism, implicit prejudice, and judging based on outcomes, not the process. I think the biggest potential ethical blind spot in this case is judging based on outcomes, not the process. So it is easy to jump to, oh, the meds have worked great, so that's the solution, right? But I think it's important to slow down the process and weigh the pros and cons and continue to do so, because this decision doesn't have to be the forever decision. Our ultimate solution, based on the facts and the opinions of the decision makers, and in this case, I know the doctor didn't get to be interviewed and the school didn't get to be interviewed, but several times I've received feedback from the school, in fact, phone calls from the school when my children didn't take their medication and asked me to bring it for them because they were not able to maintain in the school classroom without it. Our ultimate decision was for both the children to be on medication. My husband's ultimate decision was that the cons outweighed the pros for him as far as the side effects of the medication. And my decision about medication is to be determined as I work with my own doctor to come up with something that works for me, while still acknowledging that there are other options available and celebrating differences in the family rather than leaning on the stigma that sometimes comes with neurodiversity. And the way that I talk about this decision, I look at it from that pragmatic point of view while also still recognizing that justice is fairness, right? So my kids may have a greater opportunity to access these resources given that we have medical insurance, and my husband and I have experienced ADHD our entire lives, though I was just diagnosed within the last couple of years. And we went through the inquiry process that is important in pragmatism, asking those questions, right? Coming up with open-ended questions and allowing my children to partially make the decision themselves, to assent, while providing the consent for them to take their medication.